Welcome to this Autism Ontario webinar, Ask the Doctor, Autism and Mental Health, a focus on caregivers. My name is Matthew Lay, and as always, I will be your host. In this webinar, we are going to be discussing the importance of supporting caregivers in the autism community and call attention to issues of equity in this domain. It will also make a case for the importance of promoting connectedness and compassion for self and others in programming in the programming and supporting caregivers, and highlight the CARES program as an accessible option for caregivers looking for such resources. Throughout the presentation, you will get a chance to get your questions answered by our guests today, who are both first-timers on this Autism Ontario desk. First, we have Dr. Shivapalan. He's a family doctor by profession and believes in the potential for change to the current diagnostic landscape for children with autism. After 6 years of busy and fruitful family practice, Dr. Shivapalan left his practice to help facilitate this change with an interest in child development. And we also have Kira Vimalakatan. She's a PhD candidate in clinical psychology at the University of Waterloo, and she's currently completing her pre-doctoral residency at Surrey Place, driven by her passion to improve mental health supports in diverse communities. Dr. Kira, thanks for joining us on the desk today.
Hey, Matt.
So happy to be here.
Excellent. So right before we get started, I've got two more housekeeping items, so just bear with me. One is, guys, as you know, my job is to get questions from you answered. So put them into the Ask a Question or the Q&A box right below my video, and we'll be going through those. And at certain times in the presentation, we'll go ahead and look to get them answered for you. Also, if you've never been here before, make sure you check out the handout section. We've got a lot of great resources that help inform our conversation today. And along with those, information on the CARE program and how it is that you can sign up if you are interested. Okay, so usually I get started with a very broad-based question for our audience about the importance and why we're here today. But it looks like one of you went to the same presentation school that I went to, because you've done a great job in setting this up. You can't pour water from an empty cup, which makes a lot of sense. But why are we starting this webinar with this image on our screen?
So I think you can look at this empty cup in a couple of different ways. One is that this really represents what Dr. Shiv and I have seen when we work with caregivers, that most of them are running on empty or are very close to it. And beyond that, if we don't adequately support caregivers, they can't support their children and families. So with that empty cup, they don't have any water to give to their loved ones. And caregiving is so uniquely rewarding. It's one of the hardest jobs in the world, but it's very mentally and physically demanding. So without that proper support, it can take a toll on your health and your psyche. And burnout is a family caregiver's worst enemy. And so that's why we want to really shine that light on how important it is to support caregivers.
Right.
And just adding to what Kira said, I think sometimes in our very busy lives right now, we can all be blind to the fact that we may be running on empty. And like, I remember this one mom that used to come to the center, and this is pre-COVID, she'd come drop her child off for therapy, and then head back to get her other child ready for school, and then go to a full-time job. And then on top of that, she was volunteering her evenings and weekends to help out at the center. And I remember going and asking her, like just checking in, like, how are you doing? Like, how's everything been? And she really gave me an answer that kind of highlights this whole empty cup aspect. She was like, I'm not sure, right? She'd go on to kind of tell me that, like, she was feeling exhausted, having trouble sleeping, and other like symptoms of stress. And when I asked her if she felt burnt out, she was just surprised. She was just like, wait, is this what burnt out feels like? And I think the mom scenario is like fairly common among caregivers out there. And sometimes we're always on the go that we miss these subtle signs that our body is telling us to take a break, to take some time for ourselves so that we can eventually refill our cup.
Well, that's important. I mean, we're not all trained professionals like you two, so we don't know exactly what the signs are. And we look around at everybody else, and they seem to be feeling the same thing. And so it's just about putting that one foot in front of the others. Kira, I'm going to start with you here into our presentation, and you got into this just a little bit, but why supporting caregivers? I know you talked a little bit about the burnout factor, but let's get into this formally. Why is it so important that we be focused on supporting caregivers?
So that's a great question. We get asked that a lot, obviously, with our program. And the reality is that the research shows that caregivers of people with ASD report elevated stress and social isolation. So caregiving itself, as I mentioned, is a really tough job, but among this population in particular, it can be very challenging at times. And many of the existing services out there focus on the child and skill development, and that's really important. But within the family unit, there are many caregivers, from parents, grandparents, siblings, that are all looking for support. And the existing programming that's out there right now doesn't really address that piece for caregivers right now. And beyond that, what we ask caregivers in this population to do uniquely is implement early intervention with their kids. So we're depending on them to support their child and to sort of scaffold their development. And as we go back to that sort of empty cup analogy through and through, if they don't have the resources to support themselves, how can we ask them to do right by their child? And so when we are able to put out these programs targeting caregiver mental health, we increase capacity not just for the caregiver to support themselves, but manage their children's behavior and overall just have a very positive impact on the family system.
Kira, we got a question coming in, which I think I know the answer is self-evident, but I'm going to ask it anyways before we move on to the next stage here, and that is, we got a lot of parents on here clearly with children who are on the spectrum, and they're wondering if there are any specific advice for ASD parents raising ASD kids, and are there any supports that are targeted specifically at these parents? Is that primarily what the CARES program that we're going to be talking about today does?
That's exactly right. So Shiv and I, really took a look at the landscape of what is available for caregivers. And a lot of it tends to be sort of unstructured parent support groups, which are really lovely and are great resources for parents. But we realized that beyond just having these groups, caregivers need skills, right? They need sustainable ideas and tips to be able to use in their daily lives. And that's really what CARES is all about. And we'll be talking about that more later for sure.
Excellent. All right, we're going to invite Dr. Shivapalan back. Before we go, we got a great comment from someone who's watching who's thanking both of you for your involvement. Autism Ontario and SAC continue to lead the way for the community. So thank you so much for that comment. Dr. Shivapalan, one thing I've learned doing this for the past decade is that within the autism community and general mental health, it's not easy to get supports. So I think a lot of us are aware of it, but can you talk a little bit about some of the barriers that you see in accessing supports in the community?
Yeah, no, I think this slide really kind of highlights that. There is quite a lot of barriers out there for mental health services and specifically for this community. And kind of what Kira had highlighted when we first started developing this program, there really wasn't anything available that just focused on the caregivers. We were actually very surprised when we were looking around. We couldn't find anything just to redirect families to. And what we were able to find was very parent skill development, more primarily focusing on helping the child through the parents doing stuff at home. And at that time, we would normally kind of redirect families to counseling services, their family doctor, or a psychologist. But those pose their own barriers, right? Some were very pricey, right? Or it was difficult to find therapy that worked with a caregiver, like a mom and dad's schedule. Most of the options are available during 9 to 5 hours, which can be very difficult for caregivers to set aside when they have to take their child for therapy and have other interventions in place. And then to add to this, for a lot of caregivers, there was a lot of social and cultural stigmas around mental health. And that can be a significant barriers for a lot of families. I remember one caregiver, I was concerned about, and I was recommending her to go see a therapist, but she was so worried about how it would be perceived by her spouse or in-laws who were living in the house, and she didn't know how she could access care without them finding out. And even more interestingly, when Kira and I first started developing this program for caregivers, we initially wanted to do it one-on-one. We thought one-on-one was a standard and we should just do that and that would be the best solution. But it was actually a group of caregivers that came to us and completely changed our course and led us down that group format. They told us just how coming and speaking to other parents was just so helpful. And it can sometimes be very difficult to go over your own struggles with other friends, families, or therapists that don't have a child on the autism spectrum. Like they don't have the same shared experiences. And that's what made me and Kara really realize the importance of shared experiences and kind of using that to really help families connect. And I think on the next slide, with what 2020, what ended up happening is it added this whole different layer of complexity, and that was COVID, and all of us were impacted, right? And in a world we live in where social distance is now the norm, families are struggling, feeling really isolated, and these headlines really kind of highlight that. They seem detached, feel detached from the rest of the world, and it can be very overwhelming. And then add on top of that, now they're cut off from therapies and other organizational supports that they typically have access to. A lot of our caregivers that come to SAC were saying, it wasn't just for our child, but we were also able to chat with other families when we were there in the waiting room, and that was such a relief for them. And in addition, now for quite a few caregivers, some of them may have been laid off, right? And therefore, now they're limited in financial resources. And another thing is all these social activities, just being able to go to a movie and go out and have dinner with friends, right? Or group, gatherings, religious events. Caregivers now have limited access to those, or they're completely non-existent. And I think these headlines really highlight how COVID now has taken those already existing barriers and have now added a different level to it. And now caregivers are feeling completely burnt out.
So I found it interesting. You were talking about, we got a comment here from a group from the Ontario Caregiver Organization, Northern Ontario, who is echoing what you heard and what you've implemented with the group and the and getting caregivers together. But when you move from that one-to-one, the norm or the standard to the group, how did you find the outcomes? Did you realize those advantages when you had the groups together?
Yeah, so initially, me and Kira were really worried. We were thinking there was going to be a significant drop-off, right? But when we compared it, we had caregivers that were signing on for one-on-one and would come for a couple of sessions and tell us everything was fine. And what ended up happening was a couple of the caregivers actually said, can I bring a friend in? I'm like, okay, doing the whole consent process. They brought their friends in, and suddenly the discussions got a bit more in depth. And not only that, they were able to support each other without realizing it. And then the follow through. So now instead of just a couple of sessions, they wanted it weekly. They wanted to continue going, and they helped build this shared identity with each other, and just continue that going forward even after they were done all their sessions. And so that really made Kira and I look at it and go, group formats are really useful, and there is a benefit of having other parents kind of share their experiences and in a structured way, because sometimes it can go off the rails if you just let one parent lead the other. But when there's a foundational structure behind it, it really helps them.
Right. Okay. So now we go back to our glass half empty. And before you guys move on, we have a very simple, but I think to the point question that came in from an audience member who says they're hearing you. They recognize, burnout, I guess, when they see it and are feeling it. They realize they need to speak to somebody, but who should they speak to? Who do they talk to first?
Right. So right now, the options might be a little scarce. Usually we would say, go see your family doctor first. They're your front line to accessing mental health services. There are plenty of sort of public services that allow sort of free walk-in or, well, at this point, virtual walk-in or appointment based counseling or sort of caregiver support. But the reality is that for caregivers of kids with ASD in particular, the options are limited. So as we will talk about later, we are, taking registration for this program. And I think CARES is a great start because not only do we have facilitators kind of running the groups, but there are tons of other parents that you are then connected to. And we find that, and Shiv was talking about this earlier, the value of having those groups. These groups become their own sort of little support networks. Parents are empowered to seek support from other parents, but also give support to other parents because everyone's been through some sort of shared experience there. And I think that's what's really valuable about this program.
So for everybody who's interested already, and we're about to just transition into the program portion of the dialogue, but in the handout section, there is a sign up link for the CARES program. So we're sitting with our empty cup, or in my case, my empty coffee mug now. And what is it that the program aims to do, or what is it that the program should do to help parents in this regard?
So going back to the mom that Shiv was speaking about earlier when we started this talk, he mentioned that she didn't even realize that she was burnt out. And I've experienced that with parents that I've worked with as well, saying, I don't understand how I'm feeling is affecting the impact on my family or my child. Like I'm doing what I need to do for my child, but they're stressed beyond belief. And so we think that for caregivers who don't even realize maybe what stress looks like for them, this program does that right off the bat. One of our first modules, as I'll talk about, is talking about how to identify stress and what to do about it. And then there are some caregivers that know, as we had that question come in, they know they're stressed. They know they need to talk to someone, and they know that their cup is empty. And as I was saying with the pandemic, we might not have that access to mental health right away in the way that we might be able to if we weren't in a pandemic. And so the question then really became for Shiv and I, how do we help caregivers refill this cup by themselves? How do we train them to do that? And how do we help them keep it filled? And so that's where CARES comes in, as Shiv will tell you.
So Dr. Shivapalan, I think you're going to be taking us through the next few, but this model that you guys have introduced, is this becoming a more common model since COVID-19, or are you fairly groundbreaking in the approach that you guys are taking at the moment?
So I'm going to say that the aspect of what we call task shifting, right, like offsetting it from professionals to others, right? In this case, we're taking, in terms of our facilitators or our volunteers that run these sessions, they're not necessarily like psychologists, they're not necessarily social workers, or even doctors. They are just people that are very passionate or work with vulnerable populations. So I think that aspect is fairly, it's starting to gain a lot of traction right now in North America, but it is used a lot, for example, in India, in certain countries in Africa. So there are definitely countries that are starting to push this more because it is a low resource model, and it tends to be really effective because it's sustainable, right? You're really empowering families and caregivers to kind of, be able to take this on and to address it and support each other. And for a lot of them, I think this is a solution that is something that they can really relate to.
Right. Okay, so I'm going to hand it over to you, Dr. Shivapalan, to start talking a little bit about the program and about what you guys aim to do here.
Yeah, so CARES, and this is I love the our picture of this, and it kind of highlights it: family, community, autism, and that's what it is in a nutshell. What we're trying to do is make sure we put caregivers first, and that's really what's at the core of CARES, right? in a nutshell, if you wanted to kind of really look at what we're trying to do, it's a group-based psychosocial intervention, and it's designed really to target the social, emotional, and psychological challenges that caregivers of children on the autism spectrum face on a daily basis, and give them strategies that can really help, right? And in my next slide, what I'm going to kind of look at is that same aspect where we were talking about all those different barriers. When me and Kara were trying to address this, we wanted to kind of address every single one of these barriers as well as we could, right? For example, cost or financial barriers. We made the program free. It's available for anyone that wants it. There's no cost to it, and there's no, you're not signing up for a subscription fee. This is completely free, right? And prior to COVID, when we were actually running the sessions in person, and at the center, we actually provided respite and childcare for families, right? Now, in the mindset of COVID, we've actually, switched to doing it virtually, and that's also provided its own benefits because it's really helped, families that had limited access now be able to do it from the comfort of their own home, and this has really helped caregivers facing significant geographical barriers. So we've had families from like Sudbury, Peterborough, like all over Ontario just want to join in and now can join in without having to worry about traveling to that location. The other thing that we really tried to make sure was we wanted to address cultural perceptions, because we know this social stigma, cultural stigma can be such a deterrent for families seeking any type of mental health support. And how we tried to do that was we made sure we trained and recruited a diverse set of peer facilitators who were not only selected because of their passion, but also on their experience with working with vulnerable populations. And also, for some of them, they're actually caregivers of an individual on the autism spectrum. So that adds another level of relatability for a lot of our groups. So some of our families that have gone through the CARES program, some of the caregivers actually come back to us and be like, I want to be trained. I want to facilitate these going forward, which is great because they tend to be the groups that, a lot of families really connect and really, come in very engaged and passionate about. And then we talked about the group format. I think the group format presents an opportunity for parents to really hear each other's experiences and develop a sense of shared identity. And it's what me and Kara feel really got parents into the door, as opposed to like an individual format, which, and I'm not putting anything down about the individual format. It can really afford a lot of time for counseling, but it can be sometimes uncomfortable and isolating for caregivers, right? So in the gist of things, CARES provides 6 to 8 weeks of 1-hour sessions where you'll get to meet other caregivers in a small group setting, right? And learn skills to support mental health in a fun and innovative way. And I think Kira is going to kind of go over exactly the topics and how our structured sessions are.
Before you do, Kira, we got a couple interesting comments / questions that have come in. I'm going to kind of lump them together because I think that they are relevant and give both of you an opportunity to chime in. But one parent is suggesting that the more time they spend on themselves, the less they can spend on their child. Shouldn't they be taking this in this challenging time? Shouldn't they be taking more time on for their child, and wouldn't doing stuff like this be selfish? And I said there's two, because the other one, I think, answering one or the other will work, because the other one is why, as a parent, do I need to focus on my own mental health? How is that going to help the child? Clearly, a lot of people worried about taking time away from the child. So I'll give you both an opportunity to talk about that before we go on to the program a little more.
Yeah, that's a great question, and one that we get a lot from caregivers who are people that we work with. And it's true that, yes, that is 1 hour less that you might be spending with your child. But what I would push is the idea of quality over quantity. So when you're with your child, are you present? Are you feeling able to really authentically be there with them and support them? And do you feel that you're even kind of fully in the situation? Because I think that's what happens when we are running on empty as caregivers. They tend to not be, entirely present. They tend to be distracted thinking about what else has to be done for the day, or worrying about, things that they can't control. And I think spending this 1 hour a week with cares, because that's all it is, just 1 hour in your home right now, spending that time will actually help sustain you for the rest of the hours, in the day that you are spending with your child, and equip you with the resources to do that more effectively, I would think. Shiv, is there anything you wanted to add?
Yeah, no, I'm going to bring up another example of, I remember one mom coming in and telling us, like, after doing cares, she just, like Karen mentioned, she felt better prepared. But also she kind of brought up, she was just like, in the whole journey with the child on the spectrum, is that sometimes there's going to be a lot of ups and downs, right? Whether it be from therapy, whether it be from just other like comorbid medical conditions, there's a lot of ups and downs that you may not be prepared for, but she felt a bit more prepared now with some of the skills that she learned, right? And for her, that's that aspect, that unpredictability of certain things in life, right? And being able to have some skill sets that help you kind of go, okay, I have a toolkit or toolbox that I can kind of go into and use these skills going forward, and skills that don't take a lot of time, right? Don't, just take 5-10 minutes a day of just, breathing exercises and so on, but really make an impact long term. I think that's what I would tell a mother, is that that's the benefit. And then the direct benefit of the child is now you're more emotionally there for them in that midst of their therapy. And there's a lot of research out there that kind of highlights the direct impact on infant mental health and young toddlers and young children, in terms of when the parent or caregiver, they're emotionally doing better, the child does better, and they're more engaged in therapy. And anecdotally, I can tell you from our therapists, the parents that have gone to, or the caregivers that have gone to cares and done it and that are engaged in therapy, they find that they're, the child does exponentially better.
Excellent. So we have a comment from the audience that they're having troubles finding the link. So I'm just going to remind everyone that the handouts panel can be expanded, where you'll find more of the resources. And if you still have an issue, we'll make sure that you get everything emailed to you after the program ends today. Okay. So Kira, I think you're going to step into a little bit about the programs. So please take it away.
Absolutely. So as I highlighted earlier, the first thing right off the bat that we talk about with caregivers is identifying stress. How does it feel in your body? Because there are a lot of symptoms that people might not identify as stress. And then what do you even do about it, right? So we talk about self-care and stress management, but what does that actually mean in a very tangible way? How do we help caregivers who have so much limited time to begin with actually fit that into their day in a feasible way? As Shiv mentioned earlier, it can be 5-10 minutes. It can be 5-10 seconds, just taking time to check in with yourself, whether it's doing, breathing exercises, whether it's getting a little bit extra sleep. It can be really easy to fit that in. And that's what we're trying to encourage caregivers to do in that module. The other piece that we talk about, which I think is major because it really helps people sort of revisit how they think and how they talk to themselves in the course of the day. And we are often our very worst self-critic. And so we draw from cognitive behavioral and sort of compassion-focused therapeutic strategies to help caregivers refocus that and talk to themselves in a way that actually feels better and is also just more effective when it comes to getting through the day. And that's something I'll be highlighting a little bit later as well. And finally, the other thing that we've found that caregivers love is talking about problem solving. So how do you approach, a problem that might come up in your day? For example, if your child has an outburst at the mall, like what do you actually do about it? How do you go about approaching that problem? And finally, assertive communication is another really popular module that we talk about. So just being a more effective communicator, whether that's with your partner, whether that's with your child, whether that's with other people, service providers that you are advocating for your child with. And so there's a really diverse set of skills that we try to highlight so that caregivers can come away with even just one or two things in their toolkit.
So where did you come up with that curriculum? It seems very specific, and clearly in listening to it as a father myself, I understand the importance of each of those items. But where did that curriculum come from? What's the basis of what it is that you guys are doing here?
So I think the most important thing that drove how we created that curriculum is that we listened to caregivers. Spending time at SAC and in our own sort of work outside of SAC with caregivers, with parents, we were kind of hearing a lot from caregivers about stress, first and foremost, and just trying to navigate how to deal with that. And I think the popular sort of attitude that we tend to see in kind of, the media is self-care means like taking vacations and getting massages and, doing all these things that take a lot of time, and caregivers don't have that time. And so really refocusing for caregivers on how do we actually practically incorporate stress management into your day was kind of our first idea right off the bat. And as I had mentioned before, like I've heard from parents that I've worked with, they just don't know what to do. They either don't identify stress or they know that they're stressed, but then they don't know what to do about it. And related to that piece around healthy thinking and kind of rewriting our stories, it speaks to that as well, because that's another way of stress management, but it's kind of rewiring almost how you think about yourself and how you kind of talk to yourself through the course of the day. Because as Shiv mentioned, there are so many ups and downs that you face as a caregiver, and dealing with supporting individuals with ASD can be challenging objectively, but then if there's that extra step of you kind of beating yourself up because you don't feel like you're doing a good enough job, that's like that extra layer that you don't need. And we're trying to sort of put in more positive, reinforcing ways to think about things when you encounter those really difficult situations.
I've heard both you and Dr. Shivapalan say quick. You've used the word quick. So we have a question about, how do I incorporate self-care or stress management into my day? How do I care for myself while I'm always being, quote unquote, on the job as a caregiver? And in the scenario where there is no school or other reprieves, you already used some examples, but can you talk about some of the skills that you teach and you said an hour a week is for like program commitment maybe, but what are some of the things that you do that would allow this person who's concerned about time in regards to self-care?
So we incorporate so many different sort of approaches to self-care in our program. So even in every session, we do a sort of mindfulness exercise and a relaxation exercise to open and close the session. Both of those typically are like a few minutes long. And the workbooks that participants get in this program actually have those scripts. We also, some groups share videos so that caregivers can kind of listen to that throughout their day. It doesn't have to be at any, a specific time. It's just when they have a couple of minutes to do those things, that's lovely. And then the other pieces that we talk about, whether those are sort of assertive communication skills or sort of reframing, those are things that we try to get caregivers to practice. And the nice thing is, like, they don't have to go anywhere. It's just something that they're doing in their mind, right? And the more that they practice, the easier and the more automatic it becomes. So really, it's almost about shifting the mindset that you kind of go approach life with. But what we're trying to do is kind of give them those tools so that they can continue to practice that. One very unique module in CARES that I'd like to highlight actually is this self-compassion bit. And that kind of comes from my own background as a compassion-focused therapist and practitioner. And it's a really popular module in CARES. Parents love this stuff because it feels so new to them. And the idea is that when you're having a difficult time, you're able to recognize your distress and sit with those really tough feelings without being overwhelmed by them or judging them. And also just taking a very caring, comforting perspective towards yourself in the same way that we do it for friends, because it feels so automatic when we take care of or comfort friends. And yet sometimes it feels very difficult for us. And it might feel unnatural, especially in the society that we live in, where this sort of attitude might be seen as going easy on yourself. And it's often just much more comfortable for us to be self-critical. But being self-compassionate also means taking action. It's not just about, being kind to yourself, and it's not always soft or gentle. It means focusing on doing what will be helpful and not harmful, so that, when you're already having a hard time, whether it's with your kid, whether it's with, something else in your family, rather than letting yourself pile on when you're already suffering or ignoring your pain altogether, you are trying to do what feels most comforting and feels best. So it sometimes requires a great deal of courage. And it, for example, can mean if you're worried about your health, you go to the doctor, even if that might be a really scary experience. So when we are, I'm just switching over here, but what the research shows is that when we're more self-compassionate, we can actually cope better with negative experiences and face them more effectively. It actually increases our motivation to try again. And we tend to trust others more, feel more supported, and support others even better. In the CARES program, what we do is a letter writing activity. And in some groups, what happens is parents write these letters and send them to the facilitator, who then sends them back like several months later so that they get a chance to read it again. And parents absolutely loved it because it was such a different way for them to approach how they viewed themselves. And I think it's such an undervalued technique and a way of thinking that can have this very dramatic impact on our lives. And it's a skill. It's just something you start practicing. And that's why when we say quick, what we mean is, yes, it takes a little bit of practice, but you're doing this kind of just in your mind as you do other things, as you go through life. And it allows us to change that narrative and rewrite those stories that we tell ourselves.
So I'm just going to bring in Dr. Shivapalan as well here to maybe comment, but in hearing about that exercise, but also reading some of the comments that we've gotten, these concerns about taking time away from our children and the full-time caregiver and what that implies. Do you have people who, when they first, come to you or whatever, maybe who have not been through this type of, call it therapy or program, being, say, apprehensive or questioning, so what? I get this letter sent back to me. What does that mean, Kira? Like, why is that good for me or whatever? Do you get some people who are maybe, not believers when you first sort of speak to them about this?
Absolutely. When we first started, at SAC and we were doing these letters, people were like, what? Why would I do this? Like, I've never written a letter to myself. And right. We have some, when it feels really that much uncomfortable, we have some modifications. For example, we get caregivers to write a compassionate letter to their child because it feels more comfortable. But when we had a group of dads at SAC sit down and do this, and these are kind of South Asian dads who are culturally not super used to expressing emotions. And the impact that it had on them being able to understand themselves and understand, their family better, it was huge. And I think Shiv can add on to that as well.
Yes, specifically with that group was very unique in that sense because, one, they came in extremely skeptical. They're like, why am I doing this? I'm only doing this because my wife told me I have to be here. And then they were like, how to relate to everything? Because I had dads from all over. Like I had it from Vietnam, Thailand, and so on. And then the first session is like, what about stress and all of that? And they were able to relate over some of their experience, just the process of coming to Canada, some of them have been in post-work situations, and talking about that, they really found a connection. And it was surprising, even with language being, significantly a significant barrier for some of those fathers, they were able to connect. And I remember one dad, when we did this self-compassion letter, right? He kept it with him, and then he read it like a couple of weeks afterwards because he was just going through a rough time. And he's like, sometimes we forget to like just thank ourselves and be proud of what we've done. And sometimes for some caregivers, they've never heard that before. They've just never heard anything positive said about them. And that dad just said that. He was like, from the minute I've like been, a teenager, like my dad was hard on me, like in terms of school. And then, when I came here, my boss was hard on me. Like, I've never heard anything positive. And then I read this letter and I'm just like, wow, I'm a good dad. I'm a good person, right? And then this just gets him going forward. And sometimes we need that. We don't know when we'll need it, but sometimes we do. And just having that ability to do it yourself is such a like life-changing experience for some of these dads.
Right, and it sounds very empowering. And when you're feeling this level of stress and burnout, one of the other things that go along with it is this: I have no ability to change the scenario. I cannot affect COVID. I cannot affect the demands that are on me by my family or my work. And you feel like it's just happening to you versus anything else. This sounds like a very empowering opportunity. There's before we move on, because I know Dr. Shivapalan, you've got some things to talk about more about the program, but do you have any recommendations or strategies that would be specific to seniors with children on the spectrum?
So this is something that we were really thinking about, and you're taking our thunder away, Matt. We were planning to enough, but we really wanted to focus on, because this is something that was brought up by some of our caregivers in our most recent group, that what about grandparents? Because there are other caregivers. It doesn't necessarily have to be like mom and dad or but there are other caregivers that are involved, right? And could grandparents, and I'm being honest with you, in some of our groups, we have had grandparents in the groups, and they found it just as effective. So that's why we really use that term broadly in terms of caregivers. There is no age cutoff for this, right? So anyone can join as long as you are a caregiver. Sarah, maybe you could add on to that.
Yeah, I would completely agree. I think the nice thing about the strategies that we present is that they're not limited to, young parents or parents with young children. And often we've had sort of mixed groups in cares. So we've had kind of new parents be reassured by the more experienced parents or grandparents who have kind of gone through what this young parent is now going through. And that really empowers people, as you said, Matt, because they understand that, their caregivers, yes, they have a tough time dealing with their children sometimes, but they've learned so much along the way, and they're really good at what they do. And being able to share that wisdom, that experience with others is its own piece of empowerment.
It's a two-way street too. You hear a lot from older parents with young children, maybe if I was younger, I'd be able to handle all of this or whatever it might be. And there's guilt there, but I don't think it matters how old you are. This burnout is real. So, Dr. Shivapalan, I wasn't stealing your thunder. That was the audience asking that question, and we got a bunch more. So what I'm going to do to ensure none of us steal your thunder, Doctor, is that we're going to do the last couple of slides. Going to let you do that, and then I'm going to come back and we got a whole bunch of questions. Guys, keep them coming in. We've got a lot of time, and we plan on getting as many of your questions answered as possible.
So in this slide, what we really wanted to highlight is that, and this is something that we really tried to build into the program, is this whole aspect of, we didn't want one size fits all. We didn't want this to be something like it's a cookie cutter model that we just put in place and then, it just run. We wanted, families and each group to have their own unique experience, right? And that's really the core of care, because the core of care is our caregivers and our parents, right? And it's their shared experiences that make each session unique, right? Although we do provide like a workbook and a guide for facilitators to help, teach these caregivers these skills and techniques, it's really the parents that help direct the sessions. a lot of times, a facilitator will come and tell me, they'll be like, I started the session about what's stress, and I just opened that topic up, and I didn't have to say anything afterwards. The parents just took over. I had to maybe interrupt and give them some navigation and give them some strategies. But normally they would just, take over that session and just continue and just go through that material. So it's something that we really find useful, is having that flexibility, right? And that also plays in part with the facilitators we have. All of them kind of add their little nuances and their own. It's almost like they leave their own little touch with each one of these groups. So there's like a balance with these groups. There is that structured format, but there's also that that spontaneous aspect of what families and caregivers share. And I think that balance is what makes CARES really unique.
So I think I kind of know the answer, but what is the stated goal? What do you want caregivers to come away with once they've completed the program?
So I think really, I would say the ultimate thing we want caregivers to gain is an understanding that they're not alone and that they're in their difficulties. We also want them to gain some foundational knowledge and skills, right? So that they can manage the experience of stressors that they can encounter in their day-to-day life, right? We also want them to get some preventative skills that help foster better thinking styles or cognitive styles and help promote this whole aspect of self-concept, right? A positive self-concept, right? And then we also want them to have a sense of empowerment, right? As individuals and as caregivers, so that they can support their own mental health as well as that of their family unit, right? And I think overall within care, really the goal is, even if a caregiver comes in and they walk away maybe learning one skill out of the 6 to 8 weeks, but they've met another family or another caregiver they really connect with, and they've added that person to their support network, I think that's a win for us. And that's what Kira and I really look at, is just helping these caregivers really connect. And Kira, I think you would probably add on to this in terms of what else that you think, we really want from our families.
I think what you highlighted was great. Ultimately, we might have parents who show up and learn maybe one skill from the 6 weeks, as Shiv mentioned. And that's okay, because ultimately, if they've connected with other parents and other caregivers, if they've been able to share that those common experiences and develop a sense of shared identity as caregivers of individuals with ASD, that in itself is something so very impactful. And then ultimately, if they are able to pick up one or two things that help them support their own mental health in their day-to-day lives, and maybe even support the mental health of their kids and the rest of their families, because when they learn and when they show that they are taking care of their mental health, other people in the family notice, and other people in their lives realize how important it is to be able to fill that cup, right? And so that you can share it with others.
Yeah, I think parents that are on this, based around, my experience on this desk and what we're talking about, are so accustomed to, getting involved in programs that are geared towards helping their children. And when I say geared towards helping their children, strategies, tactics, skills, interventions for the child. What makes this so unique and not something that, I've heard a lot about, is that it's an hour a week for the parents, and a place where they get to focus on themselves and learn what's going to make them in a better position to give that care and be happy in general. I'm going to give you guys an opportunity at the end for a moment of Zen, anything that you missed, but now we're going to look to get some more of our questions answered. Question here, I think it was in relation back when we were talking about the letter writing exercise, even though that was parent to parent generally, is what about children that are nonverbal? Letter writing exercise or exchange may not work. What other tools or strategies have worked to form that connection? So this might have been asked before you finished the comment about how the letter was being addressed to themselves and not to the child. But I think it does bring up a unique, you probably encountered the, anxiety, stress, and all of these problem levels increasing, and there is a uniqueness when a child is nonverbal. Do you have any experience with that, or any ideas about how the program might help?
So I guess I'll start with that. Oh, sorry. Go ahead, Shiv.
No, go ahead, Sarah. You go ahead. You start, and I'll jump in right after.
Okay. I think, yes, when a child is nonverbal, that can perhaps feel, uniquely difficult. And I think, though, in some ways, being able to relate to your child in other sort of forms of communication can be important. And so even when we go back to that idea of sort of self-care and stress management, we make sure that we discuss the importance of all sorts of sensory experiences when it comes to managing stress. And some of those are skills that parents can teach their child as well, because it can be like self-care or stress management can be taking a shower. And I know that I work with one client with ASD whose way of soothing himself is going and sitting in the shower. And so I think that there are lots of different ways in which the material that we teach here can help parents connect with their children, even if they are nonverbal or have limited verbal capabilities. Shiv?
Yeah, and I think especially with that self-compassion letter exercise, we've had caregivers which English may not be their first language, so they may write it in their own language. But we've also had families where we just got them to draw or paint, right, to express themselves. And sometimes just doing that can sometimes be, and it doesn't have to be like a scenic, realistic picture. It could be very abstract, but it just helped with them establish that. And then sharing that, sometimes they've shared that with family, even their own child, and it can be such a useful experience. And then getting your child involved and so on. So there's ways they can, and this is the unique aspect. We've kind of figured that out with caregivers telling us this, right? So like these options to these different exercises, there's a variety of ways to run each exercise, right? And to do these and learn, but still pick up the same skill set you want, right? So what I would say to that, that caregiver that was asking that question is, yeah, if you want that child to be involved in their nonverbal, maybe trying like the painting aspect, the drawing aspect, and seeing if that goes, right? As more of a sensory component to it.
This question came in, and I think you spoke briefly about it when you're talking about the DAS group and some of the backgrounds. But in general, people are wondering if there are conversations that you discuss in the program about developmental trauma or a trauma narrative in general.
Absolutely. So there are a lot of opportunities where I think we open that door for parents to be able to talk about their own experiences. One of our biggest focuses, actually fairly early on in the program, is around the sort of, for many parents, the traumatic experience of understanding what ASD means for their child. So being diagnosed, especially for many of the parents we work with from sort of racialized communities, this is all very new to them, and they have these dreams for their child that they then feel has been kind of taken away from them. And, in the current service landscape in Canada, at least, there are lots of different treatment options for your child to sort of help develop the skills that they have. But for many of these parents, it's also still important to be able to process those feelings that first arose when they heard about, this diagnosis. And some of that might be a very traumatic reaction. For others, it may present an experience of relief or understanding because, they finally understand what's going on. And so caregivers from diverse backgrounds being able to talk about this experience is really impactful for the whole group. And then later on in the self-compassionate modules, as well as kind of the problem-solving pieces, actually, those both present a great opportunity for caregivers to be able to talk about their own sort of difficult experiences, their own sort of developmental trauma.
People are asking for the best way of contacting you guys. I know that, again, in the handouts, we do have the sign up form for the program in general, but what's the best way of getting in touch with both of you guys?
So we both do have emails that we can provide the moderator, and feel free to kind of reach out regarding, this program or any other queries you may have. So we can certainly provide that to you. They're a little long,
Okay.
given our names, so I won't
Yeah,
say
we're
them
not going to
out
say it
loud.
out loud. We'll make sure they get out to everybody. Fair enough. What do you think is the most important thing or task that a caregiver should focus on outside of, I guess, self-care and self-compassion, which we've been speaking about consistently today, when they're taking care of an adolescent on the spectrum during this very difficult time?
Shiv, why don't you start with this one?
I think the one thing is in in the context of COVID right now is one thing is doing these regular check-ins, right? Like I was highlighting very early on in the presentation was this idea that we can sometimes be blind to these physical symptoms that may be telling us that we're burnt out, and if we're not checking in with ourselves and not kind of looking into, we can kind of miss something that can be more problematic later on. And by checking in regularly, I think that's a task that a lot of us don't do. Like I'll be very frank, I think most of us, we're so busy right now, we don't do that. We don't go and ask ourselves, okay, like my shoulder's stiff, or like my neck's hurting, I'm getting more headaches. Like what could this be from? Could this be a medical issue, or is this linked to maybe possible stress that's leading to these symptoms? And I think by doing that, and especially within this community, it's like really figuring that out right off the get-go can be huge. And I think that will impact the caregivers' like ability to kind of, get themselves feeling better sooner, so that going forward in the midst of COVID, that they're feeling less overwhelmed with everything that's happened with the lockdown and so on like that.
So as we round this out, guys, there's still time for a few more questions, but bring up this last slide here. When doing a webinar on a topic like a new product or something in a marketing space, one of the most powerful things about that is to tell stories about customers who have been changed or impacted from it. I'd like to hear about, someone who's been through this program and, what they've, like a success story, what they've said outside of being, moved or happy when they got their letter a few months later or had this skill, but what has changed in the way that they are able to help their child after they get through the program?
I'd like to take this opportunity to, highlight some of the amazing people who have gone through this program and then turned around and said, we want to facilitate this program. So special shout out to people like Samantha and Gail, who are current Autism Ontario facilitators for CARES. And one thing that I remember one of them saying during a meeting with us is, this program is not about teaching parents what's right or wrong. And it's about allowing parents without judgment to share their difficulties and to learn how they can be better for themselves and for their children. Because so many of their experiences have been about, and they may have felt it's about what they could be doing better, and how they can improve. And this program teaches them, hopefully taught them to step back and be able to just be, right? And I think that was so valuable to hear for both Shiv and I, and gave us a sense, okay, this is the right direction that we're headed in with CARES.
And just to add to what Kira said, I think there's quite a few caregivers that really stand out to me. We've been doing this for a few years now. We've seen a number of caregivers. But like some of their comments, like I remember one mom just saying, like, I was able to find myself again, right? For the longest time, she felt like, she just felt like, since her son received the diagnosis, she was just her son's mother. And it was all about the aspect of treating the ASD and moving forward. And she forgot all the stuff that she used to do before, right? And so she really felt empowered after this, that she could now go back and take some time and not feel guilty about doing so, right? For me, that's one of those stories that really stands out, because that mom is doing great right now. So she's doing fabulous.
That's amazing. So we're about out of time. I got a few things I got to do in my wrap up, but is there anything that you didn't get to say that you want to ensure that our audience hears? Any parting remarks for everybody?
Sure. I think one thing that I wanted to mention from what you were saying earlier, when it came to focusing, taking 1 hour of time away from your child to be able to focus on your mental health, and coming back to this sort of, filling the cup piece. If you want to show your child that mental health is important, and that, because even kids with ASD, adults with ASD can encounter a whole host of other sort of mental health challenges. And so showing them as a caregiver that you are also prioritizing your mental health will mean the world to them, because they will be able to see how much of a priority that is, and they will be able to fill that cup for themselves too. And I think this program really puts that at the forefront.
And I think, just to add to what Carrie just said, I think like our primary takeaway message is that, honestly, for all the caregivers out there, like if you can spare 1 hour a week for 6 to 8 weeks, you may actually leave with something very surprising from the care sessions. You may actually leave with a sense of connectedness. And I think that's the heart of care. It's the shared experiences of caregivers that connects us all.
Excellent. Well, with that,
we can help each other out.
Perfect. You dropped right there right before that, but we caught that last line. Thank you so much, Dr. Shivapalan. Thank you so much, Kira. I have lots of positive comments in the Q&A. If you're looking to find out more about success stories or, from the program, on Monday on the Autism Ontario blog, there will be a story posted about the CARES program, giving you more details as well as referencing some of those success stories. As always, this webinar will be recorded, archived, and available tomorrow on this link. So if you know any family, friends, loved ones, someone down the street, whoever it might be who might benefit from this webinar, please do share the link. The more people we have come through the program, the more of these webinars we can put on. And with that, that comes to the end of our time. So I want to thank our presenters. I'd like to thank you for joining us, and I look forward to seeing everybody on our next Autism Ontario event.